Cebu Neuroscience Foundation is addressing the question, is sustainable healthcare development achievable in Africa? We believe it is. What is required to achieve sustainable healthcare development? Number one, we believe, and the cornerstone of healthcare development is education and training. In 1923, the doors of Corlew Teaching Hospital were opened by Governor Gordon Gudgesberg, the founder, and he fervently believed that education and training was critical to the empowerment of the people of Africa, and that if they had those tools, if they had the right tools, they could manage their own affairs and do so brilliantly. Mentoring is also very critical to that development. You can educate and train, but you need mentors there to help support and partner as they get on their feet in order to sustain the quality and the confidence of the specialists and the healthcare deliverer. The next piece we firmly believe is important is research. Why would research be so critical? When you have equality across the world, and you know that research is arising out of the country, out of the region, it raises the people and the expectations of the students and the researchers as they pursue answers within their own communities and their own cultures. As long as they have the fortitude and the knowledge and the information and the support and the partnership, it raises the confidence of the people and the sense of well-being. The next piece we believe is absolutely critical is biomedical engineering support and technical support for sustainable, appropriate equipment. And most of all, that it is a priority for all healthcare facilities that they have staff that are taking care of the equipment. If we do not have the tools that doctors, nurses, healthcare deliverers can utilize to service the public and provide the care required in Africa, you cannot have sustainable healthcare. The next piece that we feel is a cornerstone is building contemporary, research-based, best practice facilities. You have to look at the Ebola crisis right now and realize that building open wards with 20 beds is the thing of the past. And we've been preaching this for years in our foundation. We aim high and want to establish facility development that is safe for the staff, safe for the patients and their families and the community. We believe that education and training, mentoring, research, sustainable equipment and the maintenance of that equipment, as well as contemporary research best practice facilities are critical to development sustainability in healthcare development. However, we missed the biggest cornerstone, and I think I have 5 now, and that cornerstone that we are committed to is called heart power. Well, it's heart power, Marge. Heart power is caring with compassion, caring with respect, not just for the patients and their families, but everyone, for the staff and for the community. Heart power is critical because if you have great equipment and you have well-trained staff and you have a beautiful building, but nobody cares, you cannot sustain that. We are tackling that from housekeepers to surgeons. When you ask the leaders of hospitals and of healthcare industry, what is the number one most important component that they need, they say to teach our staff how to be compassionate, how to deliver compassionate care. And that's what we believe is the most critical piece of developing healthcare. Those are the building blocks and the cornerstones that we feel is absolutely critical to healthcare development. Indeed, it is achievable. In our next segment, I'm going to share with you how on earth do we get there? What is the next piece in order for us to actually move forward and develop healthcare in Africa? Stay tuned.